so what can you tell us about what Denver is doing amid talks of a potential outbreak of COVID-19?
Well, Denver has always had an emergency plan in place should an infectious disease enter into our community. And without going into the details of those plans, I'll briefly touch upon the fact that we have quarantine isolation protocols in place. We have communications in place to reach out to employers, schools, to provide guidance should coronavirus infection enter into their facilities. We work very closely with the State Health Department, our partners at Denver Public Health and Denver Health and Hospital Authority, and many other local public health departments to be prepared for this. We are prepared to give guidance to employers on how they can control it within a work setting. So in terms of being prepared for infectious disease in Denver, that's been in place for quite some time.
When you talk about quarantine, that word comes up. I think that with the news out of some other countries around the world, it's, concerning to people. What does that look like in Denver?
Well, there can be a number of forms of quarantine. It could be a person who is actively infectious or ill. It might be quarantined within a hospital setting. We routinely have quarantined people by issuing orders from this department who may have been exposed but are not yet symptomatic. We suspect they could become symptomatic, and we want to isolate them so that they don't spread it if they do become infectious. And so there are a number of ways in which quarantines can be implemented.
When the CDC talks about COVID-19 in terms of it's not if it comes here, but when, which is what we've been hearing in the United States at least, what are some fears or concerns that you would like to dispel for the general public, because we don't want to scare anyone in these circumstances?
Yeah, I think it's important to keep things in perspective. We need to prepare for this. I agree with the CDC that it's just a matter of time before it comes here. But there are a number of viral illnesses that originate in other countries that have also come to the United States. And we should make it clear, and the public should be clear, that coronaviruses themselves are not new. Coronaviruses cause a number of respiratory illnesses, including the common cold. This one is unique in that there's not as much known about it. It's a new strain. But the controls to keep the spread of it are no different than the controls that the general public or healthcare workers would implement to keep themselves from contracting a cold virus or influenza.
Are there any concerns that Denver in particular might be more at risk or more susceptible to an outbreak earlier on if and when we have an outbreak in the U.S.? Because we've got the 17th busiest airport in the world here, and obviously we don't have any direct flights from China, but is that a concern that you guys are taking into account when we look at this issue?
Well, certainly working with our partners at DEN is a major piece of controlling the spread in Denver. We work closely with them to monitor who's coming in from other parts of the world, particularly where we have seen more spread in other countries, including China. But we have protocols in place. We're ready for that if that happens here. I don't think it elevates us or puts us more at risk than any place else. I think we have the protocols in place to deal with that when it comes here.
We've got spring break for a lot of kids coming up in a couple of weeks. Families have even contacted us worried, hey, should we cancel our trip to Florida? Should we not go to Telluride for the weekend? That sort of thing. What would you say to families who are worried right now and maybe thinking of postponing travel or maybe not coming to Denver? Maybe their families outside of here not wanting to come to Denver right now.
Well, certainly come to Denver. We have this, we are prepared for this. But what I would say to those that are considering traveling to areas other than where we have seen the spread of coronavirus, travel. Follow through with your plans. The precautions that travelers need to implement are the same that they would implement to avoid contracting a common cold during travel or influenza. I know that there's a lot of concern around this, and that's because it's new, and we need to give it its due attention and be prepared for it. But to keep this in perspective, tens of thousands of people die from influenza in the United States every year. And still we struggle with getting people vaccinated for influenza, okay? This is a different type of virus that causes the same symptoms. The precautions are the same. Very basic. Wash hands often, particularly before a person were to touch their mouth or their nose or their eyes. Before they eat. Particularly, that's even more important when they're in travel because everybody touches more things when they're traveling. But it's the same basic precautions. Sanitize things that are often touched at home or in a work setting. Just be aware, follow through with the same things that we do to avoid other types of very common respiratory illnesses.
What about the face masks? I know even people in our own newsroom went out last night to buy some. Is that something people should be stocking up on? No, people should wear face masks when they strongly suspect that they have been exposed to coronavirus and are experiencing symptoms. They should call their primary care physician before going to the office to get instructions about how they should prepare to go to the office for treatment. But it's not advised that the general public start walking around with face masks to prevent the spread of coronavirus.
Do you think that the dialogue right now around coronavirus is being overblown? Do you wish that people would listen more to, the warnings that you're giving out there, that it's very similar to, protecting yourself against the common cold?
Well, there's still some things that are unknown about coronavirus. I think we need to pay attention to this. I think there is some misinformation, but again, the guidelines for controlling this are no different than many, many other respiratory illnesses that as a general public we deal with every day in our communities. So I think it's important to be prepared for it, but it's also important to keep it in perspective so that people don't overreact.
Are there any other preparations, like you were talking about, washing your hands, anything like that? When it comes to quarantines and talk of that kind of thing, you mentioned that you were speaking with employers about how they can work with their employees to protect themselves. Anything else that you want the public to know about how to prepare for a pandemic like this? Stay
informed. There's a lot of great information being put out at the local, state, and federal level from the CDC. Stay attuned to what that guidance is. And then, again, follow through with the basic precautions. And be aware that if you've come in contact with somebody that has been traveling to areas where it's more prevalent, then be very, very diligent with following up with a primary care physician to talk about what precautions should happen now. And sometimes that might include being isolated for a while to make sure that if a person does become infectious, we keep it managed.
Bottom line here in Denver, should we be worried?
I think we should be informed, be aware, and continue to follow the basic hygienic practices that we promote every day in this department and other local public health departments, to wash hands, be aware of your surroundings. If you're around people who are coughing or sneezing, try to distance yourself to the extent that that's possible. Don't go into work sick. Many people don't want to use vacation leave, don't have vacation leave available. It is very important in controlling this and many other viral illnesses to stay at home. And not just to stay at home until the symptoms subside. Contact your primary care physician and get some guidance on when it's safe to return to work. With coronavirus, like many other respiratory illnesses, the infectious period is highest when you're most sick, but it doesn't completely dissipate when the symptoms are gone.
I want to circle back to the beginning of what we kind of talked about just real quick. When you were saying there's a procedure in place should we get to the point of an outbreak for quarantine procedures, that sort of thing. Have we ever had to employ those?
Well, we've employed emergency protocols for other situations. The city of Denver, the administration has a very robust emergency response plan for a wide range of things. We practice to be prepared for that. I don't know, well, we have implemented phases of protocols when we suspected that there might be an infectious individual coming in on a flight or coming in on a bus into Denver, but we've been able to get that under control, assess it quickly to make sure that it doesn't spread. So we're prepared.
Going back to the airport, you know, we talked about looking out for travelers coming from China, and it used to be that that was really the main focus. Now that we're seeing other cases in Italy and Iran and other countries around the world, is it almost, what's the protocol like at the airport when, yeah, you can't just look at people coming from one country anymore with that one travel history?
Well, I think, again, you know, if a person's going to travel, it's wise at this point in time to seek guidance depending upon where they're traveling to from their primary care physicians. They can certainly reach out to their local public health departments to get guidance on that travel and to get guidance on when they return. And then all the protocols that I mentioned in terms of engaging in community events and being aware of your surroundings, that should be done when people are in travel just as we would do it here.
But for people coming in from other countries, you know, who aren't hearing this kind of messaging, how does the airport kind of target those individuals when there's so many different locations that they could?
Yeah, the airport does have a screening protocol. That's a part of their emergency management system. So the average traveler may not know about that, but it is there. And their emergency staff out at DEN are well aware of this and all over it to make sure that we're controlling it.
Does the Denver Post reporter have any questions? Do you want to weigh in?
Yeah, one of my questions would be, I know you keep comparing this to similar things with the flu or the common cold and ways we would prevent this, but obviously the response from the CDC is much different than the response to the flu when we're talking about, you know, possible pandemic and not a question of if but when and all of these things. So what is the difference? Why sort of this elevated response than simply the flu or other things like that?
You know, there was a pandemic of influenza a number of years ago, and quite a few years ago now, and you would have seen the same type of response. I think people tend to forget that that occurred. I think what the reason it's that you're seeing it elevated somewhat is because there's still some things that are unknown with novel coronavirus because it's new. And so researchers are looking at that. The CDC is looking into it. So there are still some unknowns. But what we do know right now is exactly what I said, that there are a lot of comparisons to other types of viral illnesses. So the protocols for controlling it are the same. But we need to stay diligent and continue to learn about it in case new information becomes available that makes it much more serious than the organisms that I've mentioned already.
Excellent, thank you.
Last thing for me, as you know, more information does come out. I know recently they have put out information saying that really only 20%, I think, around there of cases are severe and could be fatal for people. Can you just go into the numbers there? Because I think there's one of those misinformation pieces is that if you have it, it's a death sentence, which...
Absolutely not. The mortality rate for this is slightly higher than influenza at this point, but it's very similar in that those people who are unfortunately passing from this virus are people that are often immune compromised already with some type of respiratory illness, and then older individuals that are again because of their age, somewhat immune compromised. When you look at an average healthy adult in the prime of their life, it's very similar to what you experience with influenza and other types of respiratory illnesses. So the mortality rate is not much higher. Right now, we're seeing the same people that have the most severe impacts. It's the same community where we see the most severe impacts with influenza.
Do you guys have any questions? Anything else you want to say or add that you feel is important that we didn't cover yet?
Well, you know, again, more than ever, you can't reiterate enough the importance of good personal hygiene, even more so when people are traveling. They touch more things, they come in contact with more people, sometimes much closer contact on planes and buses and trains. So all the more important to be diligent about your surroundings, cover your coughs. If a person has to travel and they're experiencing those symptoms, they should try to cover their coughs, their sneezes. People should isolate themselves to the extent possible from other people who are experiencing those symptoms. Doesn't mean they have coronavirus, but that's just good public health practice to protect yourself. And the best way to do that, we touch things all day long. We pick up organisms all day long. It's not going to absorb through our fingers. We have to ingest it or get it into our system by touching our face. And we have to wash our hands before we do that, particularly before we eat or we put our hands to our mouth. So keep doing what you should be doing.